UNESCO Remote Radio Week 2021. Live on connectonair.com and remoteradioweek.org.
Connect on Air.
UNESCO Remote Radio Week 2021. Get ready for a week devoted to helping radio stations broadcast remotely. Live on connectonair.com and remote-radio-week.org.
Hello and welcome to this next session in Remote Radio Week. My name's Dr. Laurie Hallett. With me now is Melinda Frost. And Melinda is a risk communication and community engagement expert, and she's the team leader in health emergencies at the World Health Organization in Geneva. Melinda, welcome to Remote Radio Week. We have a set of questions to ask you. Okay. So I'd like to jump right in because this is a short session. I think this is really where we need to start. How are people best placed to understand all the background and basic facts about COVID, and where can they find reliable and, for that matter, up-to-date information about this public health emergency?
Thank you, Laurie. This is a really important question, and it's a pleasure to be part of this program today because I believe that radio stations, particularly local radio stations and remote radio stations, play such a vital role in helping us to get out information, particularly at a difficult time now. I mean, this is, I hope in my lifetime, in our lifetimes, one of the worst public health emergencies we're going to face. And part of what we can always anticipate during a public health emergency is that there's going to be a lot of uncertainties, and particularly with something new like COVID-19, there's a lot of science that's changing along the way. So it's important to kind of stay on top of those facts, and it may not be so easy when you're not part of the technical inner loop on developing the scientific facts or understanding the scientific facts behind COVID-19. So ways in which those in radio could be more sure that they have the updated information is to constantly check with your local ministries of health. Those are our direct line from the World Health Organization to update all the information around what's happening with COVID-19, in particular the vaccines that are being rolled out now. So that's a good thing to do, is to constantly check factual information. You can also look to the World Health Organization, either the global site or our regional sites. We are always updating information in several different languages. So those are important things to check out, in addition to World Health Organization offices in countries as well. All have the most updated information that you can have. I'm sorry, Laurie, I can't hear you.
That's put that down to operator error, which will be, in other words, my error. What about the issues around verifying information? How do you behave as a broadcaster, for example, if you're faced with what you believe to be false or misleading information?
Yeah, I mean, it's good, and I'm really happy you asked this question because I hope that radio journalists and radio managers are understanding that they should look at information and really try to decipher whether or not they think it's factual. Always look at the source of the information. If it's from a scientific institution, from say a Ministry of Health or the World Health Organization or another well-known Centers for Disease Control, likely, I mean, it's true. If it's from another source and it seems like it might not be true or it seems sensationalized, please check that, and please don't pass on that information unless you've verified it. Sometimes you'll see false information, and it's exciting, right? And it's something that can, catch people's attention. So one way of dealing with misinformation in a way that doesn't spread the misinformation is to create what we call a truth sandwich. There may be, say, some misinformation about vaccines. And when you hear that as a radio journalist, it's important to sort of state that the factual information, say, about the vaccine, and then maybe hint at the fact that there may be some rumors or some misinformation being spread about that particular fact, and end your communication with the factual information as well. So it's the first thing and the last thing people hear is the factual information, and then that is hopefully what will set in their mind versus the false information. What we try to say is not to repeat the false information, because that's what people will remember after they hear your radio broadcast.
What about editorial strategies? You're dealing with individual stories, but you're dealing with the broader pandemic and all the I wouldn't say peripheral, but the other issues around this pandemic. What are the
Mhm.
best editorial strategies to get messages across?
Yeah, I mean, I think radio is in a unique role when it comes to this, because what we're seeing is that there's a lot of maybe misinformation or misunderstanding that's getting spread around primarily through social media. And much of that has to do with the fact that social media comes in short form, right? Just a few sentences, just a really interesting graphic, and something that's pretty easy to kind of share and move on without stopping to think about the information that's there. The unique advantage that radio has is that it allows for a longer conversation. It allows for a little bit more debate and more explanation behind some scientific information. So to me, radio has a critical role in bringing the conversations forward around COVID-19 or really any health emergency. It's important to kind of explain the background of the science in a simplified way so that people understand the relevance to their lives. In addition, you may have sort of differing views on that. Maybe bringing the debate forward is an important thing to do too, as long as people understand the factual information and understand how these health recommendations we're suggesting really affect their lives and those around them as well.
What about fear, uncertainty, and doubt? What happens when a broadcaster is confronted by a clear reaction from an audience that they really don't understand the situation? How do we deal with that as broadcasters?
Mhm. Well, I think, again, when it comes to any emergency and a public health emergency, and then one where, at least initially, there wasn't a lot of information out there, there's always going to be levels of uncertainty, and that, depending on the audience, may lead to certain sort of fear factors. How is this going to affect me, and so on, it's important to understand maybe where the audience is coming from. In some cases, we'll see individuals that are more fearful than they should be, right? Maybe the health issue isn't really going to affect them as much. And maybe some people have an under concern for where they need to be. Maybe they're part of that audience that really needs to kind of go out and get vaccinated, but they don't see that as such a threat. So it's important to kind of understand their audience. And I think with most radio stations, they clearly kind of understand who their listening audience are, and to understand where that audience is coming from. When it comes for COVID-19, it's important to know if the audience understands their risks, and if they don't, maybe they should, and really clearly communicate that with them. A good way to do that would be to bring on some key influencers, understanding who the audience is most influenced by. And that may be healthcare professionals, it may be scientists, or maybe people just like themselves. So if you can bring in the story element, bringing those individuals that really can have an impact and influence the audience in the way we hope they would be impacted, which would be safe behavior, bring those people on to tell their stories and really have them be able to communicate. Also, two-way communication with the radio audience, the listening audience, is a critical area that we could really use some help with. So I hope the radio journalists and the managers understand how much we truly view you as partners in dealing with this pandemic and other public health emergencies.
So I guess really what you're talking about here is that the important thing is making people understand the realities of situations. And if you contextualize that with local examples, things that are within people's experience, that's something which really helps people grasp what are understandably complex issues. And as you say, also issues that change over time. So what we knew at the beginning of this international pandemic was very different from what we know now, and we're still learning.
That's true, and that's exactly what science should do, right? I think some of the feedback we get sometimes is like, oh, well, that information changed, they didn't know. Well, no, that's exactly what science is meant to do, to keep learning and keep finding out. Our job is to then communicate that information rapidly, right? And in a way that people can understand and absorb that into their lives, and take action.
Melinda, that was a really informative. I'm sorry this session is so brief, but I hope that viewers and listeners found that to be interesting. A source of information that I use, just as a parting shot, I wonder what you think of this. When we've been doing work on this here in the United Kingdom, we've gone to the Johns Hopkins University data site in the US for the long form work, which some people may be doing on COVID. Is that the sort of source that you might also draw upon?
Yeah, there's several universities doing some really interesting data crunches and research, and I would consider those also good sources of information. The Johns Hopkins site also, for your journalist audience, has a lot of social-behavioral feedback in there, and that may be also important to look at. You can look regionally and local and by country and really see sort of the perceptions of risk and the actions that individuals are taking in terms of mask use and vaccine hesitancy related issues. So it's another good way to get insight into the audience and what they're thinking in order to be able to communicate with them about potential actions they can take and decisions they can take in their lives to help, of course, protect them, their families, and then protect others around them.
Thank you. And as we wrap things up, we could talk about this for a long while, and there's such a lot to discuss, but we've run out of time. If there's one web address which you would point people at, which would that be?
I think that there are many out there that are trustworthy. Easily, I can point to the World Health Organization, who.int. Right up front, there's information about COVID-19 and advice for the public. I think those are some good places to start. Lots of questions and answers in there. They may be even the same questions that radio journalists are getting asked themselves. So should be some clear answers in there that they can peel out and use.
Melinda Frost from the World Health Organization, thank you very much indeed for your time.
Thank you, and thanks to the audience as well. We really, again, I can't emphasize enough how much you're really helping us in conquering COVID-19. Thank you.
Thank you.
Connect on Air.
UNESCO Remote Radio Week 2021. Live on connectonair.com and remoteradioweek.org.
Connect on Air.
UNESCO Remote Radio Week 2021. Get ready for a week devoted to helping radio stations broadcast remotely. Live on connectonair.com and remote-radio-week.org.